Let's discuss the APGAR score. The APGAR score was given by Dr. Virginia APGAR. This is her last name as well as a very smart acronym. The A stands for appearance, P stands for pulse, G for grimace, A for activity, and R is for respiration. Please note this is respiratory effort and not the respiratory rate. The score is basically used in the NRP or neonatal resuscitation protocol as a prognostication score, which means that it does not guide the resuscitation of the neonate, but it just reflects the response of the neonate to the resuscitation. This is the APGAR score. This is a very good image from first aid. Let's look at it. The score is calculated at two instances, which is the 1 minute mark and the 5 minute mark. A point to note is that resuscitation NRP is started before the neonate is even 1 minute old. We are going to go from the good score to the bad score. So if a child scores higher, it's a good thing. If a child scores a lower score on the APGAR scale, it means that we need to pay more attention to the neonate and resuscitate them. Now, as we discussed, A stands for appearance. So score of 2 is given when the baby is completely pink. If the extremities are blue or cyanosed, only the extremities, then a score of 1 is given. For a blue baby or a cyanotic baby, a score of 0 is given. Pulse. One parameter here is to be remembered that the heart rate should be more than 100, which is a good score, that is a score of 2. Less than 100 is a score of 1, and no pulse in the baby is alarming, which is a score of 0. Grimace is basically the baby's response to stimulation. So a healthy baby is the one who cries and pulls away or coughs on stimulation. If they just grimace or there's a weak cry, that means a score of 1 is given. If there's no response to stimulation, we give them a score of 0. Activity of a baby, if the baby is well flexed and they're moving their limbs, they have active movement, a score of 2 is given. With some flexion, where arms and legs are a little bit flexed, a score of 1 is given. And if it's a floppy baby who's not moving, a score of 0 is given. Respiration here means respiratory effort and not respiratory rate. The baby has a strong cry, then that is a score of 2. If it's a slow, irregular cry, a score of 1 is given, and a score of 0 is given if the baby is not breathing. So, as we saw from this table, a score of 0 is the minimum possible score, and a score of 2 into 5 parameters, 10, is the maximum possible score in the APGAR scale. So, 10 is the best score that's possible. If a baby scores 7 or higher on the APGAR scale, that means that the baby is normal. You don't have to resuscitate them further. On the other hand, if the score is lesser than 7, you have to keep on continuing with the NRP according to the protocol. If the score is less than or equal to 3, that is an alarming situation. You have to provide immediate resuscitation to the baby. An example of a very low APGAR, like less than 3, would be severe birth asphyxia, the diagnostic criteria of which a low APGAR score, which is less than 3, metabolic acidosis in the cord blood gas analysis, which should entail a pH of less than 7, and some feature of neonatal encephalopathy like hypotonia, seizures, poor reflexes, and lethargy, stupor, or even coma. So this can be useful in diagnosing the severe birth asphyxia for baby. That's it. We're done with APGAR score. Thank you.